Crush injury is a direct injury resulting from direct physical crushing of muscle by heavy weight. It presses any part of the body, commonly extremities. It is caused by various incidents, such as natural disasters, war, or terrorism. It is mostly considered as a result of accident, but sometimes it happens in non-traumatic patients who have been immobilized for a long time because of unconsciousness. Crush injury can be manifested into two complications. One of them is crush syndrome. Crush syndrome leads to traumatic rhabdomyolysis, and it is characterized by significant systematic symptoms that got from toxins released by crushed muscle tissue.
Here are the risk questions of the student project. First, what is the definition of crush injury or syndrome? What is the etiology of crush injury or syndrome? What is the pathogenesis of crush injury or syndrome? What are the clinical features of crush injury or syndrome? How to diagnose the crush injury or syndrome? What is the differential diagnosis of crush injury or syndrome? What is the treatment and prevention of crush injury or syndrome? What is the complication of crush injury or syndrome? And how is the prognosis of crush injury or syndrome? The next is the purposes of the research. First is to understand the definition of crush injury or syndrome, to understand the etiology of crush injury or syndrome, to understand the pathogenesis of crush injury or syndrome, to understand the clinical features of crush injury or syndrome, to understand the diagnosis of crush injury or syndrome, to understand the differential diagnosis of crush injury or syndrome, to understand the treatment and prevention of crush injury or syndrome, to understand the complication of crush injury or syndrome, and the last is to understand the prognosis of crush injury or syndrome. Here are the benefits of the student project. The first is as the basic information about crush injury or syndrome for the future research, and the last is increased knowledge about crush injury or syndrome.
Crush injury is a type of injury that was caused by physical trauma. It is a result from compression on body parts, such as limbs, be it upper limbs or lower limbs, torso, etc., for a prolonged time by an external force. It can affect the muscles, nerves, and also soft tissues at the sustained area. And the crush injury can lead to some systemic complication that was called crush syndrome. As I've said it before, crush syndrome is a systemic complication resulted by tissue ischemia and also muscle necrosis caused by the crush injury. It has a high rate of mortality and morbidity. What happens during crush syndrome is the muscle cells break down and make its contents to leak into the circulation. The effect of crush syndrome is hyperkalemia, acute kidney injury, neoglobinuria, multiple organ failure, and also circulation dysfunction.
Etiology of crush injury and crush syndrome. Crush injury can lead to permanently disable, even death. Crush injury occurs by anything that causes direct injury to the skeletal and muscle cell damage. Example, natural disasters such as volcanic eruption, earthquakes, landslides, tornadoes, and storms make the structure collapse. So as man-made disasters like terrorism, arson, war, explosion, transportation accidents, industrial accidents, and mining accidents. Besides, cross injury can also occur after periods of unconsciousness from anesthesia, drug intoxication, trauma, or cerebral events. 10% of cross injury develop into crush syndrome, which has severe and extensive metabolic disturbance. Ischemia, reperfusion injury, stroke, bites, certain drugs such as alcohol and cocaine, and toxin can also cause crush syndrome.
My name is Matthew, and today I want to describe about the pathogenesis of this syndrome, summarized by Weathers as reversible ischemic muscle necrosis as that affected by the temperature. The lower the temperature, the longer ischemic survival time. On the examination of the victim, damaged muscle tend to absorb sodium chloride from the returning blood, or be called reperfusion. As a result, the muscle becomes swollen and rhabdomyolysis occurred. Most of the degradation products into the circulation, including potassium, which disrupts the cardiac rhythm, and hypercalcinemia can occur as a result of later absorbed calcium. Myoglobin, which filtered as at glomerulus and acidic urine, is produced. Myoglobin is condensed in the distal convoluted tubule of the kidney. The myoglobin caused impaired reabsorption, then increasing internal pressure finally causing acute kidney necrosis.
The clinical features of patients with cross injury and Kerr syndrome include signs such as myalgia, deficiency of sensor, and muscle paralysis. And there are also some signs that common to be seen in patients with cross injury, such as blisters, superficial injuries, PTCIA, and muscle bruising. And in rescue process, it is also common to come across a patient that experiences shock or even death. And in cases of patients that are being delivered to be rescued, it is also they also common to show symptoms such as nausea, vomiting, agitation, and delirium. And in Cushing syndrome patient, it is usually show sign of severe elevation of serum creatinine kinase with the cross injury clinical features present in the patient.
Diagnosis of crush injury or syndrome. The diagnosis of crush injury or syndrome takes place in several stages. However, before diagnosing crush injury or syndrome, early management should be done to the patient. After the patient is stable, anamnesis can be taken. This can be seen by looking patient history, patient medication history, patient family history, and patient social history. After anamnesis, physical examination can be performed. This begins with an inspection or look to assess whether there is a deformity, discoloration, swelling, changes in skin integrity, and spasticity in the area affected by the cross injury. Next steps is palpation or feel to assess whether there is a tenderness or not. And last steps is moving procedure. The patient with fracture usually makes grab the sound or have false movement. Further examination or investigation can be performed by using imaging and laboratory tests to confirm clinical diagnosis.
Now I'm going to explain various differential diagnoses for crush injuries that result in crush syndromes. First is hypothermia, which occurs when one's body temperature drops below 35 degrees Celsius. And then there's malignant hyperthermia, which is a hereditary disease where hypermetabolic responses occur towards halogen anesthetics and succinylcholins. And then there's the neuroleptic malignant syndrome, which is caused by dopamine antagonist receptors or sudden withdrawals from dopaminergic drugs. And then there's also sepsis, whose reactions are quite similar to that of crush syndromes, but is actually caused by microbial infections and has nothing to do with rhabdomyolysis. And then there's another one would be rhabdomyolysis caused by prolonged immobility. And then there's inflammatory myositis. And then there are also various genetic diseases that can be mistaken as crush syndromes resulting from crush injuries, such as McArdle diseases and other myopathies that can be mitochondrial congenital metabolic or channelopathies, which harbor similar symptoms to crush syndromes caused by crush injuries.
Syndrome is aggressive fluid administration using intravenous or intraosseous crystalloid as soon as possible before the extrication process. The goal of fluid administration is to correct hypovolemia, diluting toxic concentrations of potassium, and preventing myoglobin injury to the kidney, all to reduce the risk of developing severe kidney damage and cardiac arrhythmia. Forced diuresis is also done using diuretics or hyperosmotic solutions like mannitol may be used in conjunction to aggressive fluid administration to prevent renal damage. Hyperkalemia must be treated with the goal of restoring normal ECG to prevent fatal cardiac complications. A combination of calcium gluconate, insulin and glucose, albuterol, and sodium polystyrene sulfonate may be provided for membrane stabilization, cellular shift, and excretion.
Complication of crush injury and crush syndrome. The first complication of crush injury is compartment syndrome. The compartment syndrome may result in hypoxia in the tissue, which in turn will result in muscle necrosis. The next is complication of crush syndrome. The first complication is electrolyte imbalance. Among this electrolyte imbalance, hyperkalemia is the most dangerous one and may result in death. The other complication of crush syndrome is muscular necrosis, megalobinuria, and hypovolemic shock. Megalobinuria and hypovolemic shock, if not treated properly, will result in acute kidney injury.
The prognosis of crush syndrome is still uncertain because the data source comes from test reports, so there are differences in the timing of treatment. Based on several studies, 4 until 33% of patients with rhabdomyolysis or crash syndrome have acute renal failure, with a mortality rate of 3 until 50%. However, some studies suggest that early and aggressive treatment can improve the prognosis. Besides that, comorbidities, for example sepsis, DIC, ARDS, and abdominal and thoracic trauma, can increase the mortality rate of the crash syndrome.
Summary. A crash injury is a type of injury that can happen because of physical trauma. This trauma is a result from compressions of any body part for a prolonged time by an external force. Crash syndrome is a systemic complication resulted by tissue ischemia and muscle necrosis caused by crash injury. Anything that causes direct injury to the skeletal and muscle cell damage can cause crash injury. The clinical feature of crash syndrome or injury are myalgia, deficiency of sensor, muscle paralysis, blisters, and muscle bracing. The primary treatment of crash syndrome is aggressive fluid administration using IV or intraosseous crystalloid as soon as possible before extrication process. If patient with crash injury or syndrome doesn't get treatment, complications such as electrolyte imbalance, muscular necrolysis, hemoglobinuria, hypothermic shock, and acute kidney injury may occur. The prognosis of crash syndrome is still uncertain.